Well, welcome to everyone joining me for this session on trauma-informed teaching practices, teaching self-regulation through mindfulness. My name is Dr. Don Matthews. I'm an adjunct professor at Brandman University in the wonderful state of California in the United States, and I'm pleased to be able to present this poster session to you. I am exploring some new technologies today. I'm going to be using a screencasting recording with my PowerPoint, which is actually now converted to a PDF slide. So it allows me to maybe zoom in a little bit. We'll give it a try here to see if I'll be able to do that. No, I guess not. I'll just be able to scroll. So I apologize, the print size is a bit small. Hopefully you can enlarge it on your screen. Let me just first start off by saying my presentation is a poster session, a virtual poster session, but this is really more of an analysis of the current literature on mindfulness and also on trauma-informed teaching practices in relation to mindfulness. My particular research interests have been in the area of what we call metacognition in the field of psychology, relating to how we use our self-knowledge and our self-regulation in order to accomplish things, how we use our skills, how we engage in cognitive monitoring and cognitive appraisal to determine whether our skills and the strategies that we use are effective strategies. And I find a great deal of connection to the field of metacognition and cognitive psychology with this idea of mindfulness. Um, Specifically, I work in the field of special education. I was a special educator for many years, and in both in the what we call the K-12 educational system in the United States and also in higher ed. I'm actually a retired lecturer from the California State University system. I work part-time at Brandman University teaching courses for them in the Department of Special Education. And I'm particularly interested in trauma-informed teaching practices. This seems to be a very relevant topic for this day right now in the year 2021, especially since we are still in the midst of this COVID pandemic. When we think of trauma-informed practices or trauma-informed teaching or trauma-informed instruction, we're thinking about those students who come to school having experienced some form of trauma. And that could be anything from a traumatic situation that they witnessed, or some trauma in the household relating to a parent or another family member. It could be ongoing trauma. It could be something like generational trauma, which has occurred over time, perhaps related to poverty or difficulties in the family that have kind of perpetuated over generations. It could be more complex traumas, which are the kinds of traumas that tend to cause children to become more affected in different kinds of ways. It may affect their development, their learning. It may be more traumatic in the sense that it causes an actual change in the child's behavior or their ability to learn. Complex traumas, all kinds of traumas, but complex traumas in particular, have a tendency to lead to greater lifelong effects. They can hamper someone's ability to not just regulate their behavior, but to be able to engage in either learning, interpersonal relationships. They can cause difficulties with language and verbal expression. They can cause the child to become more dissociative, meaning more removed from reality, and perhaps even have impacts later in life when the person is grown and trying to engage in interpersonal relationships or trying to engage in work successfully. Sometimes those traumas stay with us into our adulthood. We tend to notice that for younger children who experience trauma, they often become inability to self-soothe themselves. So in the sense that we all develop our own coping strategies for when we're upset or worried or anxious or whatnot, children who've experienced trauma they're not very effective at doing that. They have difficulty calming themselves, and that's what leads to more dissociation or dissociative behaviors. They tend to avoid taking risks or engaging in things that they might be unfamiliar with, or they may fear engaging in things, and that causes them to adapt or to engage in maladaptive behaviors, which tend to be counterproductive to their own development and their learning. Um, We oftentimes think about children who've experienced trauma, and as teachers or caregivers, wonder how do we go about engaging them and helping them overcome those traumatic experiences? And fortunately, there's a lot of great research that's been devoted to understanding not only attachment theory, which is how we form caregiving relationships with adults or others, and also the idea of how we teach someone who's experienced trauma to be able to self-regulate. Um, there's a wonderful conceptual framework that I include in this presentation. It's called the ARC model, developed by two researchers by the name of Blaustein and Kinnebera. And they developed this conceptual framework for use in trauma-informed uh, organizations or trauma-informed schools. The context or the idea is that we need to not just address the needs of the child, but we also need to address the systems that support the child. So in this particular framework, you can see a diagram on the right side of the screen. It shows that there are three components, the first being attachment, related to attachment theory and how we help children form relationships, how we engage with children in caregiving relationships that helps them form attachments and develop appropriate social skills. Um, we also see self-regulation as part of the paradigm. How do we help students learn coping strategies and also how to regulate their attention and emotion so that they can be effective learners and also effective in relating to other people? The third aspect is called competency, and competency really is referring to resiliency. It's about the ability to develop the factors that we need to be resilient. So it means that the child needs to understand how to be resilient. So resilience is oftentimes taught through trial and error experiences or practice. So when we think of resilience, we think about the things that we can do to help the child learn the skills that they need in order to become more resilient. Um, there is a great deal of research now in the field of mindfulness based therapies and mindfulness based interventions. I've listed a little bit of that for you if you're interested in certain aspects of the research around mindfulness based interventions below. But just in general, this subject, mindfulness or mindfulness meditation as it's often called, has been thoroughly researched for almost 20 years now. There's a great deal of information if you're interested in a present-centered practice that you can utilize yourself to help you engage in a greater self-awareness and also help you develop your ability to regulate your attention and your own emotions, then mindfulness meditation is a very effective um, and very researched intervention that can be used for adults. Oftentimes, many adults may be familiar with something called mindfulness-based stress reduction, which was developed by John Kabat-Zinn, which is probably one of the first go-to self-therapies that we can use to help our self-regulate our attention and our emotions. And it helps us engage in a greater sense of self-awareness through activities like body scan, where we simply start to notice sensations in our body more closely. It helps us if we develop also a meditation practice, or in my case, I often refer to meditation as mindful breathing. We use breath work as a strategy for engaging in meditation. I'll talk more about that in a moment. But again, these are all components of mindfulness-based stress reduction that we engage in as participants to understand and to develop a greater awareness of ourselves. That particular model is used in many, many different kinds of settings. It can be used as a self-therapy, as I refer to them as, something you can do yourself. It's often best learned in a group setting, taught by someone who's familiar with mindfulness-based interventions and probably has received training in mindfulness-based stress reduction. It's usually about an 8-week course, and over the course of the 8 weeks, you internalize the practices and you actually learn the activities that you do to engage in mindfulness. And it helps you refine your skills. So by the time you reach the 8th week, you should be able to work and use those skills independently of being in a group setting. There's also a great deal of research now looking at mindfulness in combination with other types of therapies like cognitive behavioral therapy. You may have heard of that. It's being talked about a lot right now. The idea that we create our own cognitive distortions sometimes, and we need a little help helping us kind of unpack the things that we believe to determine how accurate they are. That in combination with mindfulness is a growing area of therapy for clinical psychologists who are using mindfulness-based interventions with their in clinical practice, perhaps in combination with cognitive behavioral therapy. So as a goal, mindfulness-based interventions really are meant to help you develop a greater sense of self-awareness, a greater sense of self-control, to increase your own self-beliefs, and to help you become a little more intrinsically motivated, which tends to lead to a greater sense of autonomy, a greater sense of self-empowerment, and hopefully increases your sense of self-efficacy. Those same feelings are also appropriate for us to be teaching to younger people, children, adolescents. And there is research that shows that by teaching these types of mindfulness-based interventions to younger people and adults, we can help them overcome experiences that may have been traumatic or adverse effects of trauma that may have manifested themselves over time. What are the benefits of mindfulness-based instruction or mindfulness-based interventions? Well, first of all, they're very accessible. You don't need a lot of things in order to implement a mindfulness-based therapy. If it's mindfulness-based stress reduction, you just simply need a guide, a teacher, someone who's been trained, and enough space where you can actually take people through the process as a group. So it makes it accessible for teachers working with students because there is usually physical space in order to do that. It doesn't require a lot of extra materials. I tend to teach mindfulness-based interventions, and mindful breathing is the strategy that I use. I teach it as a metacognitive strategy. So rather than getting into the idea of meditation, which for some people makes them a little uncomfortable, they associate meditation with perhaps Buddhism or some other religious practice or something different than they're familiar with, a cultural practice that they're not familiar with. I try to frame it as a metacognitive strategy, which is we engage in mindfulness to become more self-aware. It helps us develop a greater sense of self. It helps us to become more in touch with our bodies because mindfulness is a mind-body experience. And it also helps us to learn about how we regulate our attention and our emotions. When we engage in mindfulness, we often discover that things come into our mind, and we have the choice of engaging those things or just simply observing that they're there but not engaging with them. And that is also part of becoming mindful, because teaching someone how to become present means that it's okay to not engage with thoughts and ideas and emotions that come into your mind. So that increases our positive perceptions of ourself, that we are capable of doing things. Hopefully, for students who are learning mindfulness or mindful breathing or mindfulness-based interventions, it's going to increase their level of adaptive behavior, meaning when they're feeling anxious or when they're feeling like they're not able to take a risk, they may be able to harness those experiences in mindfulness, become more aware of of the present moment, perhaps engage in some breathing, and help themselves regulate their behavior so it becomes more adaptive rather than acting out, avoidance, fear, anger, those kinds of emotions that we often see when children are afraid to try something new or they actually have reactivated a traumatic event that they had in the past. So sometimes mindfulness strategies, mindfulness-based interventions can be used as a way of getting to more adaptive behavior. Understanding what the present moment and the present state is, we don't often have an understanding of that because we're so busy living it. We're so actively engaged in what's happening, and so we are quickly moving on to what's happening next. We're not always in the moment. We're sometimes in the future, and sometimes we're in the past. So teaching children and adults that it's okay to just be present, just to be aware of what's happening in this moment, but without having a plan to do something more or without feeling the need to engage in something more. It's just simply the ability to observe. And when we're able to harness that ability to observe and be present and regulate our attention and our emotions, we also develop the ability to reduce our emotional reactivity, meaning we're going to be less responsive to emotions as they occur. And we can take that experience and that knowledge with us to the next moment in time in the future when perhaps we are becoming a little bit emotionally engaged or reactive. We can go back to our mindfulness intervention or strategy and learn how to be present again and try to regulate our attention and our emotions. I teach a practice called mindful breathing. It's not new. It's been around for as long as mindfulness meditation has been around. Probably was it taught by the Buddha himself, and it's the kind of practice that is just simply a breath awareness practice, where you become just simply aware of your breath, allowing yourself to be present and not engaging in thoughts and emotions. And that practice is very easy to teach. It's very easy to learn. However, it has to be rehearsed. And so through modeling and rehearsal, you can teach students to engage in mindful breathing as a way of not only understanding and feeling their breath, but as they focus their attention on their breath, they become less attentive to other things that may be occurring. So those thoughts and those emotions, and it helps them regulate themselves by focusing on their breath rather than focusing on other things that may make them more reactive. After engaging in mindful breathing, I often have children or adults just take a moment to reflect. What did that feel like for you? What did you notice about yourself? Were you able to maintain your attention on your breath? Were you able to observe thoughts and ideas as they occurred, but were you also able to not engage with those thoughts and ideas? We call that thinking, by the way, when we suddenly start thinking about something and it takes us to a new place and we start thinking about that. Well, that's what our brain is supposed to do, right? However, with mindfulness, we sometimes want to just simply allow those thoughts to occur without feeling the need to engage them, just so that we can stay present and stay focused on the moment. Sometimes, I know in my own personal practice, I find that inspiration comes after a mindfulness session or after a mindful breathing session, or maybe even the next day. When something occurred to me, I didn't engage it in my mind, I just acknowledged that it was there. And then later on, when I was thinking, I was realizing, wow, there was a reason that came into my mind at that moment. It's helping me solve a problem, or it's helping me go to the next level with something that I'm thinking about. As I said, there's a great deal of previous research on mindfulness-based interventions, but I've highlighted some of the findings from various research studies that showed how mindfulness-based interventions were effective at reducing negative affect and with rumination. So when someone presents as being kind of down, maybe they're low mood, but they're also very worried. So when we say negative affect, they present with a low mood, and rumination meaning that they're worried a great deal. We've also found mindfulness-based interventions effective at helping people to increase their emotional regulation and to increase their affect. So to go from that low mood affect to a more positive affect or a positive outlook about life. Mindfulness-based interventions are also effective with decreasing anxiety and negative affect. I tend to stay away from those terms, those clinical psychology terms like anxiety and depression. There's a great deal of research that supports mindfulness with those clinical conditions. I tend to focus more on having people just observe their mood and notice differences. So sometimes we don't want to engage in medical speak or the diagnoses that goes along with sometimes determining if someone does have a more involved psychiatric profile, or perhaps they have a psychopathology that is being presented. We'll let the clinical psychologist address that, but for the purposes of an intervention, again, I mentioned self-therapy. We're seeing that mindfulness is very effective at helping people who do have whether they call it rumination or anxiety, and when they do they present with less positive mood. We're also seeing that it's very effective in helping people reduce their emotional reactivity. So if I can apply a strategy, going back to what I was saying earlier about metacognition, if I can learn a strategy and then I can use that strategy effectively, then I can appraise my ability to use that strategy and decide, can I use it again? In the case of mindfulness, we're finding that it can be effective for people who are challenged with emotional reactivity, quick to anger, perhaps just overly sensitive, or they just present and they come to an emotional state rather quickly. Mindfulness may be helpful to them as well. And then attention regulation, of course, we all sometimes struggle with that, right? Especially children. Um, Mindfulness helps us to become very grounded, helps us to become very present-centered, and it helps us to see what's happening in the very moment. So for people who struggle with attention regulation, mindfulness becomes a go-to strategy. And I'll share a personal story with you. My youngest grandson was diagnosed with ADHD, attention deficit hyperactivity disorder. And when he was very, very young, I started teaching him mindful breathing. And I found that on a couple of occasions, I noticed that he would just go and do it himself when he became reactive, or when he was not feeling quite good about himself in a moment that maybe something occurred. He would actually go and sit quietly and close his eyes, and I would see him breathing. And I think that if we can teach children and adolescents how to use mindfulness as a metacognitive strategy, so that they're able to harness its power to help them when they have emotional challenges or when they have difficulties, either regulating events in their life, or when they feel that they need to take themselves away a little bit and just become very centered, it's a wonderful strategy. I've included the references, just a brief list of references down below on this PowerPoint slide. I'm also going to provide you, hopefully, uh, for the conference documents, I'll provide you with my paper that I wrote on this. It's a much more elaborative scientific paper. But also, too, I'm providing you down below here with information. If you'd like to contact me, you can do so at my email. I've listed a couple of sites. One is my personal Google site, and the other is a site called Mindfulness for Teachers. If you would like to learn more about mindfulness as a metacognitive strategy, something that you can learn fairly quickly yourself and apply, then I invite you to go to my website there. It's completely teacher self-directed. I originally developed it as a micro-learning website for teachers who wanted to learn how to engage in mindful breathing. It's certainly not an 8-week course, but it will give you an overview and take you through a practice session so you can understand what it is a little bit more. So again, thank you very much. I enjoyed presenting my PowerPoint to you, or my single slide to you, and I look forward to your questions. Thank you very much.